Hello, I'm Dr. Vandita Samavedi, an internal medicine physician. Welcome to Haldi Living with Doctors today. We are diving into one of the biggest shifts in clinical practice since electronic health records, the rise of artificial intelligence in medicine. AI isn't just a buzzword, we are using it in our clinical practices every day, and not just doctors, patients are also using it regularly. With these tools comes a new set of questions about clinical judgment, the algorithms, and the future of the doctor patient bond. Today on Healthy Living with Doctors, joining us is Dr. Sanjay Subramanian. Dr. Subramaniam is an intensive care specialist, an entrepreneur, a medical leader with training at the esteemed Baylor University, Mayo Clinic, and CMC Vellore. He's the founder of Omnicure, a pioneering digital health platform which uses remote ICU monitoring and is transforming telecritical care. We are in conversation today on AI in healthcare with a physician who is also a classical music maestro and regularly performs on the international stage. Welcome to Healthy Living with Doctors, Dr. Sanjay Subramaniam.
Thank you for that wonderful introduction and very kind introduction, Vandita. It's a pleasure to be here.
Thank you, Sanjay. And recent surveys show half of Americans are using AI to diagnose themselves before they even call their doctors. What would be the best AI tool for a patient to use right now?
For diagnosing themselves, I don't think there's a single tool right now that I would advise anybody to use to diagnose themselves. I don't think AI tools are mature enough yet that patients should rely solely on AI for diagnosing conditions. I think AI can help them with probabilities of what they might have. Perhaps it can give them some guidance on disease conditions. It can summarize evidence behind different disease conditions, but I don't think relying solely on AI to diagnose disease conditions is advisable at this point. I think having a human in the loop is very important.
I think that's very well said. And here we see the importance of why AI tools have their limitations. They can be helpful in some ways, but also not the best tools yet for diagnosis. AI is a great research and documentation assistant right now. Are there any particular tools that you're using?
Epic EMR has its own proprietary ambient listening tech tool that they have, I think, incorporated recently. This one, yeah, that one that comes to my mind in terms of ambient listening is something called Suki, Suki.
Hmm.
We have actually trialed that in our telecritical care platform, and it performed fairly well. So that's one that comes to my mind.
Mhm.
Um, yeah, and there's related to all of this, there's also AI that's being incorporated into a lot of the clinical decision support products. For example, UpToDate has now an AI-enabled
Yes.
module which helps improve the robustness of the clinical response to a question. So there's definitely a lot of things that are happening at this time.
Absolutely. Such a growing field right now.
Yeah, indeed.
In your mind, are there any big areas for improvements that you see in the current AI algorithms for medicine?
Oh, there's obviously, I think this is just the tip of the iceberg. I think there's still a lot of work that needs to be done to improve the reliability of the AI tools. I think AI still is fraught with hallucinations. So that is something that has to be addressed. But I think as the data sets become larger and larger and as the models get trained better, I think these tools will only improve. But I always have to say that, AI, it's a huge responsibility on the clinicians to use it. And there has to be a proper governance in the clinical arena before you decide to use it. So there has to be enough checks and balances to make sure that it's not being used inappropriately, because that can lead to bad outcomes. So that's all very important. But um, I think a lot of a lot more research needs to be done. I think large, trials need to be done about to assess objectively the impact on the outcomes of clinical care using AI tools. I think all that has to be done, and the whole thing has to be systematized as opposed to, just anecdotal evidence.
when we are saying there's an ambient listener in the room and people wonder, is the data going somewhere? Is the insurance company going to see it? Is it really training some chatbot somewhere? So those are all important things when we are so particular about patient privacy.
Correct. Yeah, absolutely. I think, yeah, and a lot of, care platforms already use chatbots as initial as screening tools, etc. But I think the accuracy of all those has to improve over time. And I think it's a very important to decide when you need to come out of the automated chatbot AI loop and just have the human intervene so that things don't go the wrong path.
Absolutely. Yeah. At a specific patient appointment, I saw the patient who had mostly anxiety and also had heart disease. Most of my appointment time, 80% of it was on the anxiety that the patient was experiencing. And later on the summary, I noticed that the AI had completely focused on his heart disease, which brought me to think, is AI insensitive to the emotional side of medicine? Or is it just programmed to prioritize certain medical conditions? What is your thought?
Right. Absolutely. I think it all depends on the kinds of model that it's trained on. And I think there are certain red flags for AI tools. It's taught to highlight certain things like, chest pain or heart disease, strokes, and things like that. Those are high morbidity or high mortality conditions. So I think the models probably inappropriately lean towards those areas in a given interaction because that's to avoid the
Missing
risk
out,
of having
right?
missing out,
Yeah.
yeah, on those things because anxiety is not perceived as a serious health condition
Mhm.
according to most people, I suppose, but heart disease is. So I think that's exactly right. Uh, so I think the bottom line is this. I mean, I think all these models have to be refined and trained and retrained. And I think as the AI technology matures and gets even better, I think that will happen. But it remains to be seen. I think medicine sometimes we get over optimistic and then the final results don't pan out. So then
Yeah,
we're back to square one. So I think always measured optimism is the way to go.
absolutely. I agree with you. Yeah. Sanjay, are you ready for some rapid fire questions?
Okay.
Okay. What is one AI tool that you recommend to friends or family?
Anthropic, Claude,
Okay. What is one thing that a patient should never trust AI to tell them about their health?
their diagnosis.
Is AI going to make the value of a family doctor any less?
Absolutely not.
If a medical student asked you today, would you recommend any specialization that they should choose or avoid, which you think AI might take over?
I think this is a little bit of a nuanced question. I think they should choose a specialization that they like, period. But it's important for them to understand how AI might help them and not focus so much on how AI can replace them. They should focus on how an AI can enable what they're doing better and focus on that rather than worry about how it's going to replace them. So I think that's how I would advise them. But I think it's important in general for medical students to have a robust grounding in health information technology and health systems and computer science. I think it's sort of a give important prerequisites almost for even for medicine these days.
Absolutely, yeah. I think everybody should be able to see and understand how AI is changing healthcare, and especially for medical
Yeah,
students, you're right.
yeah.
Let me see if you have any predictions, let's say in 2030, what do you envision as the biggest change we will see in healthcare?
I think more automation. I think there'll be fewer touch points with actual people. A lot of the back-end processes will get automated. I think physician efficiency, I think, will improve, especially in certain areas which are today highly dependent on a lot of manual intervention. So I think efficiency will improve. So I think there's a number of things that we'll see by 2030. I don't see any particular field completely disappearing uh, from medicine. That's my prediction, at least.
Yeah, absolutely. I would love to see how things change and
Yeah.
make us more efficient, make us more accurate. That would be great. You're right. How has AI specifically changed your life as a doctor? Tell me about Omnicure and how are you using it in intensive care?
Sure. Well, first of all, in terms of intensive care medicine, there's a AI for critical care actually is not that new with the phenomenon because there's always been predictive algorithms, things like that, that have been used in critical care for predicting patient deterioration. Not all of those tools or algorithms are scalable or entirely accurate, uh, but we do use them in some limited fashion. But in terms of day-to-day practice, uh, I think there's a lot of potential. Let's just put it this way. There's just a lot of potential because there's a wealth of data in the critical care units. There's a lot of data, and then that's accessible to clinicians, and those can be used for fine tuning all these algorithms. In critical care, what we really care about is predicting patient's clinical deterioration before it actually happens, right?
Yes.
So for that, you can use a lot of different data points, including, say, for example, vital signs data from the medical devices, the patient's history, physical, previous information, previous clinical trajectories. It's just a lot of information that's available. So AI can be very useful, and having these large data sets can be useful in helping develop models. And they have to be validated to ensure that they're actually accurate. So, so that's as far as critical care is concerned. But there's a lot of things that I think that are out there that are very useful to help improve efficiency in practice. For example, there's a lot of ambient listening technologies. There's a lot of generative AI tools that are out there which just help us as clinicians, not just for critical care, but even for other fields that helps us improve our efficiency. So that's something it's already being used in many institutions. Many countries, many institutions across the country are using that. Ambient listening technologies for patient interaction documentation, that's a well-known tool that's being used by many large hospital systems, and it seems to be working fairly well. I don't know that there's any published data yet on the actual impact on physician efficiency. I think it's all anecdotal at this point. People
Mhm.
seem to like it because it helps them see more patients. So I think that's definitely out there. Personally in Omnicure, we are in the process of developing or incorporating more AI tools. So Omnicure, as you mentioned, is a digital health platform. It's an acute care telemedicine platform that allows us remote physicians to provide telecritical care consultative support to patients in any ICU. We can get data from bedside devices and monitors, and these are visible to us as remote physicians through the Omnicure platform. And we have inbuilt audio video uh, uh, tools to help communicate with the bedside physicians to help formulate a care plan. So that's basically telecritical cares. But in that itself, having some basic generative AI tools, for example, to help automatically transcribe notes. So, for example, Zoom has features which will help. In Gemini, for example, it creates a transcript of any meeting, right? So the similar concept can be applied for our telecritical care interactions. So when we talk to bedside teams and do our multidisciplinary rounds, the audio video AI capabilities can help just summarize the interaction and create the daily care plan for that patient. So it just actually helps us in our efficiency. So it's more of an efficiency tool at this point. There's a number of promising AI-enabled tools out there that use both clinical data and non-clinical data that can be helpful for clinicians to uh, help with what we call population management. So if you have like hundreds of patients, but you want to know which ones to focus your attention on, there's a number of tools out there that are being developed to help us hone in on those patients because they're the ones that need urgent attention. And so you can intervene and perhaps make a difference to the outcomes. So that's sort of how AI is being used, at least in my field and in telecritical care specifically.
This has been a very, very insightful and interesting conversation today on healthcare and AI. And I'm really grateful for your time, Dr. Sanjay Subramanian. May I ask you one last question?
Sure, absolutely.
Okay. Can you share your life mantra with us?
Perseverance. I mean,
Very,
that's really it. Yeah, never give up.
very nice. Very nice. Thank you so much for your time.
Sure, thanks, Vandita.